Hey guys, Chris Lendrum here from strengthphysio.com. I'm going to apologise straight away because I've got a ridiculous cold at the moment because my 1-year-old baby keeps getting stuff at nursery and giving it to me, which is annoying, but it happens. So what I want to do today is just answer a Twitter question. I thought it would be better to just answer it on the video form because it means I can go into things a little bit more than 140 characters. So Coldeep Baines at Baines13 asks, looking for some advice, 16-year-old lad with bilateral lateral shin pain with squats, mild anteversion of the hips, ideas ? So a couple of things that come up straight away. So I think firstly what I'd be thinking about is any red flags. He's under 17, so he's a young guy. You know, young people generally don't get pain, so we want to rule out certain red flaggy type conditions. So obviously you want to be keeping an eye on constant pain, night pain. With this individual, I haven't got any more information than what I've just told you, but if he was in a lot of extension sports and he's getting bilateral lower body pain, then I'd be wanting to rule out things like spondylolisthesis. So if he is doing a lot of extension in tennis or certain other sports, then you maybe want to rule that out. So you want to rule out your more red flaggy type conditions. And then I would want to go on to look at how he squats. So if he's got a problem squatting, I want to know how he squats. Is there something he's doing in his squat that means that he's going to be getting that lateral leg pain? Sometimes people will coach now, and I coach often, to kind of push outwards. So feet staying where they are, but pushing outwards with the knees as you come down. And it might be that he's just activating a lot through his perineals and really getting a lot of activation there. And if you just change that, he might, and actually say, right, instead of pushing outwards, maybe just literally allow your knees to come down in more of a neutral position. Or sometimes even with people, especially if the load isn't massively heavy, allowing them to come in a bit if they feel that they need to with that. So just changing up how he squats is potentially could make a difference. Then obviously things like footwear as well. So what footwear does he wear when he squats? Is it that he's got things like Olympic lifting shoes? It might be lifting his heels a bit. Maybe using shoes like that might give him a change in the forces that are going through his lower body, so that might make the pain better. So just looking at things like footwear. Orthotics potentially you could have a look at, just off the shelf ones, to see whether that improves things. Again, I think with that sort of thing, you're not looking to change position, you're just looking to change forces. I think that's what a lot of the podiatrists now are saying, that you just want to change forces rather than actually changing physical structure. But those changing forces can have an impact on pain, so that's another thing that I would look at. Also, obviously, as a young guy, he may be going through growth spurts or maybe going through those sorts of things. So looking at your general tests that you would do biomechanically, so looking at muscle length, quads, tib anterior, looking at all these sorts, your normal things you do. Thomas test, looking for good hip extension, making sure the hips are mobile. Obviously, you're going to get an idea when he squats of what his technique is like, and I would get him to go low into a squat so you could really see. And also ask him to do that. If he gets pain with load, then you want to look at him with load, because you want to see, does it differ when he's doing it with load, when he's not doing it with load. The other thing that I would say is a volume of training. So you want to look at his volume of training. How much is he squatting? Is it just a case of maybe reducing that volume rather, and keep maintaining the load but reducing the volume in order that he can actually get more rest and recovery in between. And rest and recovery is another thing that I want to make sure that he's getting adequate amounts of sleep, make sure he's getting adequate amounts of nutrition, all the things that we would do. You can use foam rolling techniques as well for for the tib anterior and getting in there. Again, I would say having more of effect on the peripheral nervous system and the central nervous system. But you're still having an effect, so I still do use foam roller. I still like using it, even though I don't think it's necessarily doing anything to the tissue itself. Also, from more of a psychosocial element, asking him why he wants to squat. So what's the importance of squatting for him? Is it that he's been told that that's good for a sport, for example? Again, I don't know his whole backstory. So, why is squatting important? Is it just something that he wants to do? If the squat in and of itself is not a hugely important thing, then maybe changing up the exercise. So, maybe doing more unilateral work, some split squats, a great variation on the squat. maybe looking at front squatting or back squatting, depending on what type of squat he's doing. So actually varying the type of squat. And that variability in movement, we know that movement is good for pain, and we know that having a good variability in movement is good. So actually just by changing up where the body is being loaded, you may well offload that area and therefore bring that pain down. It may be that he wants to squat because he wants to get stronger, and he's been told that's what he needs to do for his legs. And of course, we would want to, if possible, squat because it's a good exercise. But there are other things that you could add in or change slightly in the short term, while you maybe look at some of these other biomechanical factors, and then come back to squatting when you can, or reduce the volume and then come back into it. Also, obviously, you could treat with some manual therapy, so you could do some manual therapy on the lower body, and I think that, again, manual therapy now, I think I use because I find it helpful with patients, but not necessarily, I never really tell them that I'm doing anything to muscles, tissue. Often I talk about reducing sensitivity of the area. I talk about just getting things so that you feel, your body feels like it can move better because we're affecting the nerves. So because we're affecting the nerves, often you get a feeling of freer movement and more fluid movement, and therefore when you're squatting you'll feel more free, you'll feel more fluid, and it won't be as sore. So that's kind of how I would describe it to patients, rather than saying I'm just going to release this muscle and therefore you're going to be able to squat pain-free. I think we know now that that's not really necessarily the case, but I do still use manual therapy because I think it can be helpful. So you might want to use some manual therapy down there. So I think a combination of all those things, looking at some manual therapy, looking at volume of training and more psychosocial factors, and talking to the patient about why they want to squat, changing it if you can, and modifying the load. And then some biomechanical factors as well, so looking at maybe changing the forces through the foot and ankle, through orthotics, through changing in the way you're squatting, and I think if you can combine all those things, then hopefully that will make a big difference. Hope that helps, and any more questions I'm happy to answer them. Cheers guys.